Beta-lactam antibiotics. Beta-lactam antibiotics are bactericidal. The beta-lactam antibiotics name came from the beta-lactam ring that is present in their chemical structure. So this is where the name came from. Beta-lactamase or penicillinase, these are enzymes produced by some bacterial strains that can inactivate some antibiotic molecules in penicillin as a mechanism for bacterial resistance. So this can break down beta-lactam ring in beta-lactam antibiotics, therefore reducing or inhibiting their effectivity or effectiveness. Now, beta-lactam antibiotic subclasses, they basically share the common structure, the mechanism of action, and it's basically a broad group of drugs that include 4 major subclasses. So the beta-lactam antibiotics include penicillins, cephalosporins, carbapenems, and monobactams. Beta-lactamase inhibitors are basically added to penicillin antibiotics to make the drug more powerful, to basically prevent the bacteria from breaking down that beta-lactam ring and causing or becoming resistant to that antibiotic. So beta-lactamase inhibitors are added to those penicillin antibiotics to make this drug more powerful or effective. So beta-lactam inhibitors include clavulanate, sulbactam, and tazobactam. So examples of penicillin antibiotics combined with beta-lactamase inhibitors include augmentin or amoxicillin clavulanate, timentin or tisercillin clavulanate, unacin or ampicillin sulbactam, and the most commonly seen in the clinical setting, zosyn or piperacillin and tazobactam. So the first part of this drug is basically the penicillin, and the second part is your beta-lactamase inhibitors. So if you're ever asked what form class do they belong from, then the first part would be penicillin and the second part would be beta-lactamase inhibitors. Penicillins. Penicillins are considered bactericidal. So the common sites that we treat penicillins with are skin, soft tissue, and pulmonary. So some common infections include cellulitis, sinusitis, pneumonia, and so this covers for gram-positive infection. So this is primarily gram-positive coverage. So the way it works is basically by inhibiting cell wall synthesis, which results in lysis or breakdown of the bacterial cells. Now, some side effects include itching, rash, or angioedema. So angioedema is basically the swelling of face, tongue, and larynx. So that's very dangerous and can be life-threatening. Some precautions: cephalosporin allergy, another beta-lactam antibiotic, so similar structure and similar mechanism of action. Also, the highest allergy response among antibiotics, so it is very common to have penicillin allergy, and it has many drug interactions. So contraindications, so cephalosporin allergy, basically this other beta-lactam antibiotic, there's incidence of cross-reactivity for about 1% to 4%. So we need to always make sure we assess for reaction. If there is an alternative to this drug, it is better to consider the alternative. So if we can give or administer another drug other than a cephalosporin or penicillin whenever they do have this cross allergy, it is better for the patient rather than risking a possible drug reaction. Now, nursing action include high alert if giving, again with cephalosporin allergy. Examples of drugs in this class include amoxicillin, your amoxicillin clavulanate, and penicillin G or Pen-G, and as well as your piperacillin and tazobactam, also known as zosyn.